Christian, you mentioned the elderly Hmong community, and that leads me to talk about older adults. So let's get at that a little bit. Older adults are more at risk of morbidity and mortality due to coronavirus infection. That population is even more encouraged to shelter in place, stay home, isolate yourself, and again, that isolation can lead to loneliness, to anxiety. How can we best take care of our elders during this pandemic? I mean, it's always important to me, even as I approach that elder status, it's always been important to me that we take care of our elders, but now so more than ever, what are some tips for really, digging in and taking care of our elders as we are all managing this pandemic? Let's start maybe with you, Christian.
Yeah, I think one of the main efforts that could really have some positive outcomes is really, as I spoke earlier, is the innovation portion. In terms of, you talk about micro, so we're talking about family structure, right? So you're talking about your grandmother, your great grandfather. So within your family structure, you're talking about, being more creative in terms of those visits, the virtual visits that we spoke of, and having those toasts and having those online connections. And as we were talking about earlier with Netflix, being able to watch those movies one-on-one, but on a macro level, looking a bit large in terms of the public health and overall community, you're looking at ensuring that the seniors have their basic needs met. And right now, there's a huge concern with food insecurity, and malnourishment is really big amongst the community, the senior community. And so you're looking at during COVID-19, so promoting and making accessible ongoing SNAP programs and locally funded food programs to the senior community to make this accessible for them. And also being that advocate in the community, going to these stakeholder engagement meetings and going to the legislative hearings to really advocate on behalf of individuals inside of the Department of Aging, for example, State Department. So I think there's options in terms of that level and supporting the group. And also the constant messaging, as I was saying earlier, is ensuring that through those efforts, through the community service efforts, that accurate messaging is being put out there on what they can do, what the elderly community can do, and what the options are for them versus what the limitations are.
Excellent thoughts. Sheree, anything that you'd like to add to that, taking care of our seniors?
The most important part about that statement is these are our seniors. We have to take care of each other and our community. And that may mean your reach is delivering food to your neighbors in your neighborhoods that or the elders in your family, making sure that they have some of those nutritious items, dropping them off, helping with some of the hopelessness by scheduling phone calls. If you know that every evening I'm going to call my grandfather, or we're going to make a schedule for our cousins so that each day someone's responsible for calling and checking up, that gives them something to look forward to, giving them the right information to make sure that they're getting up and exercising, that they're eating, that they're drinking, all of those, making sure the basic needs are met, and also those emotional needs. So really taking on that responsibility of taking care of each other and filling in the gap. In fact, one of the great components of Capital City Black Nurses Association is, we've been at the forefront of this pandemic as healthcare providers, and I really lean on my colleagues for support, for emotional support, financial support. We helped a lot of our nursing students through this rough patch, finding clinical placements and focusing on meeting those basic needs so that people can survive in this new climate. So, this is the time to lean in and really help each other and help where we can, because that's how we're going to get through it.
Wow, excellent. You both encouraged me. It'll be too late. I've got to make a call to someone on the East Coast, and I'm going to do it first thing tomorrow morning and just make sure that that elder member of my family is okay. So thanks for that reminder.